Hey everyone, welcome back to the Pharmacology Vault. In today's video, we're focusing on one of the most widely prescribed drug classes in cardiology, the beta-adrenergic blocking drugs, also known as beta blockers. Beta blockers are medications that inhibit the action of epinephrine and norepinephrine on beta-adrenergic receptors. By doing this, they reduce heart rate, decrease cardiac output, and lower blood pressure. They're mainly used to treat conditions like hypertension, angina, arrhythmias, and even heart failure. To understand how they work, let's quickly go over the beta receptor subtypes. Beta-1 receptors, mostly found in the heart. They regulate heart rate and contractility. Blocking beta-1 equals slower, softer heartbeats. Beta-2 receptors, located in the lungs and blood vessels. They control bronchodilation and vasodilation. Blocking beta-2 can cause bronchoconstriction, which is important to consider in asthmatic patients. Now let's break down the classification of beta blockers based on their receptor selectivity and additional pharmacological actions. This will help you understand how different beta blockers act, and more importantly, when and why we choose one over the other. Selective beta-1 blockers, the cardioselective group. These drugs preferentially block beta-1 receptors, which are mainly found in the heart. That's why they're called cardioselective beta blockers. Common examples include Atenolol, Metoprolol. These agents reduce heart rate, lower blood pressure, and decrease myocardial oxygen demand. Importantly, they spare beta-2 receptors, which makes them safer for patients with asthma or chronic obstructive pulmonary disease, COPD, though caution is still advised. Next, we have the non-selective beta blockers, which block both beta-1 and beta-2 receptors. Examples include Propranolol, Timolol. These drugs affect not just the heart, but also the lungs and vascular smooth muscle. Because they block beta-2 receptors, they can cause bronchoconstriction and should be avoided in patients with respiratory conditions like asthma. That said, non-selective beta blockers are very effective in certain conditions like migraine prophylaxis, essential tremors, portal hypertension, and even glaucoma when used topically. Beta blockers with additional alpha blocking activity. Studio microphone narrator. Finally, there's a special category of beta blockers that also block alpha-1 receptors, leading to vasodilation in addition to the usual beta blocker effects. Notable examples include Labetalol, Carvedilol. These are especially useful in hypertensive emergencies, heart failure, and situations where both heart rate control and vasodilation are desired. The added alpha-1 blockade helps in lowering peripheral vascular resistance, making these drugs particularly beneficial in managing complex cardiovascular cases. Let's now explore the classification of beta blockers based on their receptor selectivity and additional characteristics. Understanding this will help you choose the right drug based on the patient's condition and comorbidities. Based on beta receptor selectivity, non-selective beta blockers block both beta-1 and beta-2 receptors. These beta blockers act on both beta-1 and beta-2 receptors, meaning they affect the heart, lungs, and vascular smooth muscle. They're powerful but must be used with caution in patients with respiratory issues. Without intrinsic sympathomimetic activity, ISA, these drugs fully block beta receptors and do not activate them at all, even partially. Propranolol, the prototype drug, widely used for hypertension, migraine prophylaxis, essential tremors, and thyrotoxicosis. Nadolol also has class 3 antiarrhythmic properties, useful in treating arrhythmias. Timolol, often used topically for glaucoma due to its ability to reduce intraocular pressure. With intrinsic sympathomimetic activity, ISA, these agents partially stimulate beta receptors while blocking them, leading to less resting bradycardia and reduced risk of lipid abnormalities. Pindolol, useful for patients with bradycardia or borderline heart failure where you want some beta blockade without complete suppression of heart rate. With additional alpha blocking activity, these are mixed-action agents that block beta-1, beta-2, and alpha-1 receptors, providing both heart rate control and vasodilation. Labetalol, used in hypertensive emergencies and pregnancy-induced hypertension. Carvedilol, valuable in chronic heart failure due to its vasodilating and antioxidant properties. Cardioselective beta blockers, selective for beta-1 receptors. These are the beta-1 selective blockers, often referred to as cardioselective beta blockers. They predominantly affect the heart with less risk of bronchoconstriction, making them safer for patients with asthma or COPD, though always with caution. Key examples include Metoprolol, used in hypertension, angina, heart failure, and post-MI care. Atenolol, long-acting, commonly prescribed for chronic hypertension. Acebutolol, has ESA, making it gentler on resting heart rate. Bisoprolol, ideal for CHF due to its beta-1 selectivity and favorable dosing. Esmolol, ultra-short-acting, given IV in acute settings like intraoperative tachycardia or hypertensive crises. Betoxolol, also used in glaucoma with less bronchoconstriction risk. Celiprolol, unique for its beta-1 blocking and beta-2 agonist activity, which promotes bronchodilation. Nebivolol, the newest generation beta blocker, promotes no-mediated vasodilation, offering additional BP-lowering effects. Let's start with the most common use, hypertension. Beta blockers like Atenolol, Metoprolol, Bisoprolol, Carvedilol, and Nebivolol work by lowering heart rate and reducing cardiac output. They're especially useful in patients with comorbid conditions like heart failure or post-myocardial infarction. Next up, angina pectoris, or chest pain due to ischemia. Beta blockers such as Propranolol, Atenolol, and Metoprolol reduce oxygen demand in the heart, making them effective for long-term management of stable angina. Following a heart attack, beta blockers like Metoprolol, Carvedilol, and Bisoprolol are life-saving. They prevent arrhythmias, reduce infarct size, and improve survival. These drugs are a cornerstone of post-MI therapy. Only specific beta blockers are used in heart failure, and they include Carvedilol, Bisoprolol, and Metoprolol succinate. These reduce mortality and improve symptoms when used alongside ACE inhibitors and diuretics. Beta blockers like Propranolol, Esmolol, and Nadolol are key players in managing arrhythmias, especially supraventricular tachycardias, atrial fibrillation, and atrial flutter. Esmolol acts quickly and is ideal in acute care settings. Having frequent migraines? Propranolol and Timolol are proven options for migraine prevention. They don't treat the acute attack, but they reduce frequency and severity over time. For conditions like essential tremor, Propranolol is the go-to agent. It helps suppress involuntary rhythmic tremors, especially in the hands. In hyperthyroidism or thyroid storm, Propranolol is used to control symptoms like palpitations, tremors, and anxiety. Bonus: it also inhibits peripheral conversion of T4 to T3 at high doses. For open-angle glaucoma, topical beta blockers like Timolol and Betoxolol are used to reduce intraocular pressure by decreasing aqueous humor production. Non-selective beta blockers such as Propranolol and Nadolol are used to lower portal venous pressure and prevent bleeding from esophageal varices in patients with liver cirrhosis. Feeling anxious before a big presentation? Propranolol is sometimes used for short-term relief from performance anxiety by blocking physical symptoms like shaking, rapid heartbeat, and sweating. Important safety tip: in pheochromocytoma, beta blockers like Propranolol should only be given after alpha blockers like phenoxybenzamine. Why? Because unopposed alpha stimulation can cause life-threatening hypertension. If you found this video helpful, don't forget to like, share, and subscribe to the Pharmacology Vault. We bring you fresh, easy-to-understand pharmacology content every week, so be sure to hit the bell icon and never miss an update.